Welcome to our show, Ask Your Doctor. I'm your host, Shivani Raj. For today's show, we have Dr. Pallavi Gowda. She is an osteopathic internal medicine physician who holds strongly to the oath that she took in medical school to preserve the health and wellness of her patients. Her greatest priority is to maintain an optimal state of both physical and emotional well-being for her patients. She received her medical degree from Kentucky College of Osteopathic Medicine and Masters of Health Administration degree from George Washington University. So without any further delay, let's welcome her. Hi, doctor. I hope you're doing well. Welcome to our show.
Hello, I'm doing well. How are you?
I'm doing great. Thank you so much.
Thank you. And thank you for having me on this show. I appreciate it.
Thank you so much, doctor. Doctor, without any further delay, let's get on to the show. First of all, doctor, there are so many new viewers watching the show. Can you please introduce a little about yourself and what do you do in general?
Sure. So I'm a primary care doctor, internal medicine trained, as you just stated. And I have my own private clinic in Rockville, Maryland. And I also am very active in public health and community health. So keeping individuals healthy. I especially near and dear to my heart is the South Asian community, since that's where I come from. And those are my passions. I also deal with a lot U.S. veterans, as I myself was in the U.S. Army, and so dealing with mental health issues, PTSD, and so forth like that.
So, doctor, what are some common conditions that you deal with on daily basis? Can you tell the viewers, if they're coming to you, with what issues can they come in? How can you help them?
Sure. So primary care doctor or internal medicine in my case sees 18 and above years old, and we are the first line of medical providers who are often seen. General practitioners is another way of calling it, and so we see all sorts of ailments from simple musculoskeletal to mental health, or really any kind of concerns that people may have as the first person, the first line of seeking medical care. Things that we address that often other doctors or specialties don't necessarily get into are emphasizing lifestyle medicine. So therefore people remain healthier and prevent disease or control disease that they have already, as well as advanced care planning and so forth like that. So I think it really is, it gives us a chance to not only be the first line, but also address things that don't overlap in other specialties.
Yes. Doctor, when I was reading a little about you, I read this something called as the osteopathic internal medicine. So I myself don't know exactly what that is. So can you just give a heads up about what it is?
Sure. So osteopathic medicine is very prevalent in the US. There's two types of medical schools. One is allopathic medical school, where you get an MD degree, and the other is osteopathic medical school, where you get a DO degree. Osteopathic doctors learn osteopathic manipulative treatment, which is basically another form of diagnosis. It's seen as a holistic medicine where it helps us diagnose as well as treat elements, many ailments, far more than we'd often think. It goes beyond musculoskeletal diseases to also things like gallbladder disease. There's certain diagnostic tests that we can do in the office, just with our hands and the ability to diagnose, that really help patients. The other beauty of osteopathic medicine is the value of human touch, right? So when we're examining, we also have a therapeutic component by just the human nature and the whole the healing approach to human touch. So that's what osteopathic medicine is. It's a more holistic approach.
So does that mean that the osteopathic way of medicine is much safer and easily available for the patients than the allopathic way?
So osteopathic manipulation, often requires time. So primary care doctors in certain practice settings would be able to do it more. In a traditional busy practice where there's just 5 minutes of time, then it may be difficult in terms of treatment, but the diagnosis, yes, can be done. We can minimize the number of diagnostics tests that are needed, so make diagnosis earlier. And would I say it's safer? I would, because I think that it offers a more comprehensive approach in, as I said, the healing touch, as well as improving diagnosis and treatment.
Yes. So does that mean that osteopathic is a pretty similar to chiropracticing or physiotherapy?
Think of an osteopathic doctor as someone who's been in, had the training of medical school, but we take an extra class on with these hands-on manipulations that often chiropractors get the notoriety for. But because we have the medical school knowledge, it helps us treat patients better. Now, I will say the beginning of osteopathic medicine in general was before FDA was prevalent in researching the side effects of medication, because at one point, medication side effects were often more dangerous than the disease processes themselves. And so Dr. Andrew Still, who was an allopathic physician who created osteopathic principles, really suffered from that when it came to the health of his children. So that's where this started. Now, with the merging of the residencies, so the advanced training and prevalence of osteopathic physicians in top institutions, so the recognition is being made, and there's emergence between use of medications and osteopathic principles. So I think it's much more unified, and I really think that it is healthier.
So doctor, let's say, I'm a very new patient to you and I have a very bad, severe back pain. So if I'm coming to you, how will you first examine me? What's the whole process like? And how do you personally deal with it?
Sure, that's a great question, especially bread and butter for osteopathic physicians and what we love to do. So if someone comes in with back pain, one of the primary hallmarks is trying to understand what was the trigger for the back pain, as any doctor would do. But when it comes to what's unique about osteopathic principles, as I was mentioning, I'm going to use this diagram, or not this diagram, but this here, in order to show really what we're looking at. So this is the vertebrae. This is how, if I were to look at your back, turning you to the side, it would look like this, right? So we have, so we know in osteopathic principles that there's certain movement. For example, each vertebrae can actually move and misalign, which if you can see these vertebrae close up, these are the nerves that come out. So if there's a misalignment in the vertebrae, then the nerve can get impinged, and really wherever this nerve innervates, it's going to cause sharp back pain. And so what we can do is basically realign the vertebrae through some myofascial techniques, counter strain. Some choose to do HVLA, which is often gets the term for cracking. I tend to stay away from that, but through techniques, we can realign the vertebrae, which then you're dealing with the root cause of nerve impingement. So, just day to day, we're mobile creatures, and so day to day activities can cause a misalignment in vertebrae, for example, and cause back pain. And this is one example of where osteopathic medicine is very principles would be very relevant. In allopathic medicine, it's traditional to say, okay, take ibuprofen or brufen, as they say in India. With osteopathic medicine, we can do these manipulations. We can also say take a lower dose of ibuprofen if needed. We're not adverse to taking medicines, but I think the combination of the diagnosis with the misaligned vertebrae, the treatment to realign it, and taking maybe a lower dose medication is far safer and better for the patient in the long run.
Yes. So doctor, when I was going through your website, when I was going through the menu of services that you were providing, the first thing that popped up was fitness. So in what way? I mean, like, I think this will be a very great doubt for the viewers. When we have gyms and stuff, how will you personally, help them with fitness? In what ways will you help them?
I really firmly believe in lifestyle medicine. So maintaining a healthy lifestyle, I often emphasize that the 4 pillars to good health are good emotional well-being, good nutrition, physical activity, and good sleep, restorative sleep. So those 4 things, physical activity being one of them. I am part of the National Obesity Society, and so there we emphasize 150 minutes of physical activity per week. And so that's kind of the national standard. Not only do I practice what I preach because I'm a long distance runner myself. I run marathons and I'm a Zumba instructor. So I firmly believe it when I'm telling patients it's not just something of theory for me. It's the endorphins that comes with physical activity is almost seen as a natural high, and therefore it makes people feel better. It helps their serotonin, their dopamine levels, which are happy hormones, you can think of it. And so I think that the physical activity is very linked to improving health in terms of decreasing risk of chronic illnesses like diabetes, obesity, heart disease, which in South Asians is more of a prevalence of heart disease than any other population. And especially in the US, we're 3 times more likely to have heart disease in South Asians than general population. So that being stated, with the specific populations, I emphasize physical activity more, not to mention the whole mental health aspect of how it can help.
Yes.
So, in our county, we have fitness programs that are available for seniors, that are available for low income. And so knowing these resources and relaying that to patients as trusted sources is often one way to help patients get healthier.
Yes, we will get into mental health, but like for now, you just spoke about how as South Asians we have a very different lifestyle in general. Our food habits are very different. We have rice basically every single day. There is lack of proteins because a lot of them are vegetarians, and they don't take proper intake of proteins, which is again not great for the health. So, according to you, doctor, what is like some basic lifestyle and food changes that you want to tell to the viewers watching the show right now?
Sure, that's a great question. So, one of the concept of the 3 R's I learned from when I did my Master's of Health Administration, but I attributed to nutrition as well. So, eating the right foods at the right time in the right proportion. So, all of these are very important. It's not enough to do one without the other. So, decreasing your carbohydrates, yes, our beloved rice, especially I try to emphasize to my South Asian patients, have a little bit less of the rice and more of the sambar, or more of the vegetables that go with it, and try to fill whatever you can have in one plate as one meal. Traditionally, our largest meal, I think it's just related to culturally, our largest meal tends to be in the evening, but actually it should be the smallest meal, right? So when we talk about the right time, uh, more if you really love carbohydrates and feel you don't want to cut it out or minimize it too heavily, have it earlier on in the day, because when we eat carbohydrates, one of our ways that our body lowers its sugar level is by physical activity. So our muscles absorb glucose. So if you have carbohydrates earlier in the day, then as you're walking around and doing your daily activities, your muscles will absorb the glucose and there's less staying in the bloodstream. And so that's the right time aspect. So eating the right foods, more of the proteins, especially the plant-based protein sources, are very important. Our dals, our lentils are very important to have. They fill you up longer, and they are healthier in terms of nutrition as well, wound healing, immunity, building your immunity, all of that proteins are very important. Fruits and vegetables, can never be understated. Or never be overstated, I'm sorry. But so those are kind of the main principles. Anything, when we think of carbohydrates, it's usually a beloved rice, anything made of flour, chapati, naan, all of the really tasty things tend to have a lot of carbohydrates. And we analyze specific foods more if someone is diabetic, but really we want to try to prevent diabetes, and so that would be the key.
Yes. So, doctor, let's talk about mental health. I think if we specifically talk about the importance of mental health, it can go to another episode also, because that's again a very important topic that a lot of South Asians tend to ignore. But I think the topic of whole mental health started coming around like 5 years, when people were stuck at their homes, they realized, oh, what anxiety is, what depression is. So, can you talk as a physician, how important mental health is for your physical health?
You're right. This could be a conversation for a whole nother session, but mental health and physical health, so our mind and body are linked, right? So we're linked by hormones that circulate throughout our bodies. Examples I can think of is when someone gets very stressed, let's say before an exam. Some people have loose motion or diarrhea, right? You might have heard this before
Yes.
exams. The reason for that is dopamine and serotonin are prevalent in our brains, and I mentioned them earlier in terms of regulating our mood, but they're also very prevalent in our colon. When our hormones are off balance, then the functions of wherever they exist are also off balance, right? So that is the link there. But in terms of the importance of mental health and importance of having a strong supportive network around you, that is invaluable. Often, I get the question, we all go through sadness, we all have situational stressors. When do we seek professional help? When is it the time to see a doctor about it? And so I would say that anytime it comes to your mind, going to your general practitioner is never wrong. And that is the correct answer. Sometimes we may tend to advise our friends or family members ourselves, but really having an objective person who can look at the whole picture and advise is really what's recommended. Depression is an extreme form of sadness where, traditionally what's in our textbooks is people have different sleeping patterns. They may socially isolate themselves. They may not perform as well in school or work. But our South Asian community, we're strong and resilient. We're taught to be that academic and professional success is very important. So we may often overcome some of these symptoms or even mask these symptoms by being professionally successful or getting straight A's, where you see someone and you may wonder, do they really have depression, but they're getting straight A's, or they've got a promotion at work. And so we can't use our traditional definitions anymore. So really, I would say that if you're ever concerned, recommend having them see a professional. And going to their primary care doctor is the best place to start. It's a objective, non kind of threatening, comfortable situation, hopefully, where you can ask questions. And so I think that when it comes to youth, for example, I've noticed that when I have stated the challenges that I've had in my own life, or periods of time where I myself have, felt very sad, and how I've overcome those situations, youth see that and they see it as, part of destigmatization and, being more comfortable about their challenges, because the reality is youth today face different challenges than we did when we were growing up. So I think talking about it and sometimes it requires us opening up, sharing our stories, and being vulnerable, so that they understand that it may be a common thing, and they're not anyone who where it's out of the norm, and they're comfortable to seek help.
Yes, perfect. So, doctor, finally, during this conversation, you did emphasize on the importance of proper sleep. So, nowadays people are having a very different lifestyle. Everybody has a very different lifestyle. There is sleeplessness happening. There is insomnia. A lot of people are on sleeping pills. Even like a lot of my friends, they're like, I can't sleep at night, so I am taking a sleeping pill because that kind of helps them to get back to sleep. But when I had a phase when I couldn't sleep properly, the one thing I started doing was meditating right before I go to sleep. I can calm myself down, and also hitting the gym. It really helped me, with a proper sleep pattern. So, can you tell the viewers watching the show what are some lifestyle changes, like a very small lifestyle changes, like I did by myself? Some suggestions that you can give, especially about the sleep.
Sure, you hit on the two main ones right there. And sleep is one of the pillars to good health. It's often understated, and we hear, highly successful people who say, "Oh, I sleep 3, 4 hours, and I'm now a CEO." So, therefore, it's become normalized to have abnormal sleep. And so, some of the simple things that can be done, as you stated, meditation, mindfulness, all of that is very important to calm the mind, because we live in a very stressful, high productive society where we're constantly working on deadlines and what is the next step, often not even celebrating our current success, but moving on to the next mission at hand. And so, therefore, I think that calming the mind is extremely important. Sometimes it helps for people to take a warm shower before going to bed. It also, there's certain apps that will have white noise or kind of maybe soothing music or sound of ocean waves, things like that. That is helpful for some. But definitely most important are turning off the light and any type of strong sound input. So, you may need to add some extra covers to the shades to make it darker. I would not recommend having a TV in the bedroom where you sleep. And also, one of the simple things I tell many patients is, in terms of fluid intake during the day, they often will have a few glasses of water during when we're having our evening meal. Try to limit the fluid intake in the evening and night, because often patients will have to get up and to urinate. And so one way to decrease that is by having more fluid intake earlier in the day. So I think calming the mind, using any of these other sources to help. Also, making sure if you have any history of anxiety, getting that treated is extremely important. Physical activity is definitely important. So these are the strong components of good sleep hygiene that are very important.
So, doctor, while we were discussing previously, you did mention at a part that the risk for heart diseases, especially in South Asians, is much higher than people, than people around the world. Can you tell why is that? Why was that statement given?
Sure, that's a great question, especially for this audience. Let me show you one thing real quick. I'm really big on diagrams, or really big on ways to kind of describe what I'm saying here. So this is imagine this as vessels around. This is a cross section of a vessel around the heart. So the vessels around the heart are 3 times smaller in South Asians as they are in Caucasians, Europeans, for example. And so, therefore, you can see that if we're going to have even a little amount of blockage, it takes less blockage to completely occlude an artery for a South Asian than it does someone else who's not South Asian, right? So, because of that genetic component, we're already at a higher risk. Now, we add on top of that the excellent in terms of professional success, but what does anxiety do to our vessels? How does that translate? It really causes a kind of a chronic inflammation, a generalized inflammation in the body. And you can understand that if you already have imagine this as a pipe, these vessels as pipes. If you already have a smaller pipe, and your risk of occlusion is already there, so we plaque buildup is prevalent for South Asians as well. If we have inflammation of the arteries, then the lumen of the artery is further decreased. So therefore, you have the the anxiety that causes the inflammation that further decreases an already small artery. So that
Yeah.
is the reason why it's extra important to take care of our heart.
So, doctor, I think that was a very lovely explanation. You've used so many different, diagrams to explain to the viewers. I'm pretty sure that they have enjoyed it. Thank you again for tuning in. You're watching Sakshi TV with me, Shivani Raj.